Hi, reporting for Heart Rhythm TV, I'm Juan Carlos Zerpa, and I'm joined by Dr. Kenneth Ellenbogen and Dr. Mihail Chelu. Welcome, gentlemen, to
Thank you.
Heart Rhythm TV. Nice having you both here. And we're going to talk about the left versus left trial and aspects about it. Can you tell me about
Yes,
this study?
this is a randomized clinical trial in the entire populations that qualifies for cardiac resynchronization therapy. And we will compare biventricular pacing with conduction system pacing either at the level of his or left bundle branch.
This conduction system pacing is the new era of pacing, and we're trying to find more data and comparing. Conduction system pacing with biventricular is really, really important. What do you think, Dr. Kenneth?
Well, I think we are finally at the time of clinical equipoise where we need a large clinical trial to answer the questions about conduction system pacing versus CRT.
Yeah.
And we'll have, that is what left versus left randomized clinical trial is about. Patients will be randomized based on, or stratified based on their ejection fraction, and then randomized to conduction system pacing or CRT. It's going to be an exciting study because we designed the study and we're funded by the Patient-Centered Outcome Research Initiative. So, Mihail, maybe you can talk about some of the endpoints we'll have and the real importance of having patients involved in the trial.
Yes. The primary endpoint, it's a composite endpoint of death, all-cause death, and heart failure hospitalization. Based on our statistical estimation, it's going to be a large trial involving 2,136 patients, randomized 1-to-1 to biventricular pacing or conduction system pacing. The study will be conducted in 65 centers, 54 in US and 11 centers in Canada. As Dr. Ellenbogen mentioned, we will stratify by ejection fraction. So for ejection fraction less than 35%, we'll randomize to biventricular pacing a CRTD versus an ICD with a his or left bundle lead. And for ejection fraction between 35 and 50%, we'll randomize patients to a CRTP versus a dual chamber pacemaker with a his or left bundle branch lead. And the studies sponsored or funded by the Patient-Centered Outcome Research Institute, and we involved patients, partners, and other stakeholders in the design of this study. The goal is to identify outcomes that are important to patients, which are obtained by a number of ways, surveys, and one-to-one conversations, and other tools.
What will be the recruiting time? And when do you expect to have these results?
So we started officially the study on January 1st this year, and there will be a pilot study, a pilot enrollment of 60 patients starting in mid-September with fewer sites, with 10 sites. And then most of the enrollment will start on July 1st, 2024. And the study will last 5 years. The first 2 years, we expect or we project to enroll all the patients and then have a minimum 3 years follow-up from the last patient enrolled.
Awesome. We're waiting for this information, right?
Yes.
Do you think it's going to change the clinical practice?
I
sure
do
hoping
hope
so.
so. We'll see if the outcomes will change, but there is certainly an economic benefit as well, because you are replacing a generator with a cheaper one, so a CRTD with an ICD or a CRTP generator with a dual chamber pacemaker. And for the 35-50% range, you have fewer leads. You have one fewer lead. And the his and left bundle lead, in general, it's less expensive than a quadripolar CRT lead.
Okay. Maybe with this approach, we can treat more patients, right?
We are sure hoping so. We're really excited about the study, and we can't wait to start the feasibility phase.
Yeah, we want to wait for that, and I want to keep updated from this information too. Thank you. Thank you so much for being this time with us.
Sure.
Thank you, and see you on Heart Rhythm TV.